We're going to begin this hour with the U.S. Surgeon General as he declares this morning that gun violence is a public health crisis in America. Listen to this. More children and adolescents in this country are killed by guns every year than anything else. Let that sink in for just one sec. More than half of U.S. adults say they or a family member have experienced a gun-related incident. The Surgeon General's first-of-its-kind advisory also lays out strategies to address the gun violence crisis in this country. Only on CBS Mornings, Dr. Vivek Murthy is here to let us know exactly what he's thinking. Good to see you, Doctor, this morning. This is very important news that you're breaking, because we know gun violence has been a problem in this country for a very, very, very long time. So why now are you calling it a public health crisis, and what do you hope is going to change?
Well, Gayle, it's great to be with you today. And listen, gun violence is a public health crisis in our country that requires a public health solution. And many of us know this. We read and hear about episodes of gun violence in our communities. But I believe that we may not fully appreciate the full extent of its ripple effects across our country. Right now, 6 in 10 Americans are worried about losing a loved one to gun violence. Half of our kids are worried about a shooting in their school. And gun violence has now become the leading cause of death among kids and teens. That was not true a decade ago or two decades ago, but it is true today. And my belief is that that should help us increase the urgency with which we're approaching this issue. The good news, Gayle, is that there are solutions here. We don't have to live like this. And I lay out a series of strategies in this advisory that can help us reduce the profound toll of gun violence and help recognize that this is an issue that's infiltrated the psyche of America. People are scared in many communities I visit around the country to do normal things like go to school or the grocery store or work, and they're worried about the risk to their life.
It does. It feels, I always say, I feel like a lottery walking around. You're not safe at church. You're not safe at the movies. You're not safe at the doctor's office. So when you say that you have solutions, Doctor, what do you mean? Just give me one or two that you think could truly make a difference. Because I think now people just hear white noise, blah, 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 blah. They know all this stuff, and nothing seems to change.
Yeah, so the good news is there's a lot we can do. There are, for example, community violence intervention programs that we can invest in. There are safe storage education programs that we can expand. There are firearm risk reduction strategies like background checks and other measures that would seek to create time and space between firearms and individuals who would seek to harm themselves and others. There are a number of strategies like this that we lay out that can make a difference here. And my hope is that if we understand this as a kids issue, that we will raise it on the priority list, that we will see it not as a political issue, but as a public health issue that should concern all of us.
Dr. Murthy, it's Tony Dokoupil. It's good to see you. Good to hear your voice again. I want to call back to a week ago, thereabouts, when you wrote this op-ed calling for a warning label on social media, something that Congress would have to participate and support for it to actually happen. We've also heard since that op-ed, New York State joining some other states in talking about potentially banning or severely restricting social media for young people. What have you seen in these last 10 days, and are you hopeful that that warning label is really going to happen?
Well, Tony, it's been an overwhelming response in the last week from parents, from community organizations, and from many young people themselves, who recognize many of the harms on social media to adolescents and want those harms addressed. Look, the bottom line is that we are seeing significant harms associated with social media use among adolescents, and we're living in the middle of a youth mental health crisis. When we recognize that social media has become an important contributor to that crisis, in my mind, that makes it essential for us to take action. And last year, I laid out a series of actions Congress can take to make the platforms safer, to reduce the chances that young people will be exposed to violent sexual content, bullying, harassment, and features that would seek to manipulate their brains into excessive use. Congress needs to take those steps. And in addition, the warning label I call for would make sure that parents know the risks that we're seeing. The fact that, for example, kids who are using 3 hours or more of social media a day are facing double the risk of anxiety and depression symptoms.
Yeah, well, talk about depression. A lot of people feel depressed when they look at the functioning of our Congress. I mean, realistically, you're a fellow American here. When you see how things operate there on Capitol Hill, do you think either of these issues, gun violence or social media, is something that they can come together on and make progress?
Well, Tony, it's a good question, and I do feel optimistic, and I'll tell you why. When we look at social media, I have seen over the last year in particular, since I issued an advisory on social media and youth mental health, that there has been growing support among our lawmakers of both parties in taking action to make social media safer. And when it comes to gun violence as well, about 5-6 years ago, for the first time in several decades, we had funding, a modest amount of funding, but still funding that was finally put forward to gun violence research. 2 years ago, we had the passage of the Bipartisan Safer Communities Act, which was the first federal legislation in 30 years to help address gun violence. To be clear, there is a lot more to do. And that's why I've offered the strategies on gun violence and called on Congress to take action on social media, to help address the harms to kids. But we've got to make sure that we keep these issues front and center, because fundamentally, with both of these issues, gun violence and social media, it's our kids' health and well-being that's at stake. And what's more important than that?
Nothing's more important than that. I really appreciate you, Doctor, sounding the alarm on both of these issues. Sometimes people need to hear it over and over and over again, and we can do that. Thank you, sir, for your time this morning.
Thanks so much.